Hi there, Dr. JC Harless from Elite Muscle Recovery. So today we are going to talk about the pelvic floor. So who's at risk for pelvic floor problems? I'm glad you asked. So if you're pregnant or you just had a baby, especially vaginally, big risk for pelvic floor problems because sometimes things do not just bounce back. You have to work on it and get it to strengthen again. Any woman who's ever had a baby, menopause or postmenopausal women. So if you are feeling more lax or having frequent accidents the older you get, it could be because your pelvic floor is not strong anymore and you just need to work on it. Like anything, if you're trying to train a muscle, you have to work on it. Women who's had a hysterectomy, that's another big one. They do that more laparoscopic now, so it's not as bad, but it still continues to give you problems. Men who've had surgery for the prostate, elite runners, like gymnasts, football players, swimmers, anybody that has to hold the abdominal tight and breathe heavy. So that is giving you that pressure again in the abdominal cavity, and it's wreaking havoc on your pelvic floor because it's got to stay uplifted while the pressure is keep pushing down on it. If you're regularly lifting heavy weights or you have to lift heavy objects at work, you strain to empty your bowels or constipation. So if you're constantly pushing, again, that's negative pressure is just exploding in the inside and pushing against everything, which could cause the pelvic floor to be weak. You have chronic cough or sneeze, for those pneumonia patients and everything that has been in and out of the hospital, or you're just having a weaker moment and you had this horrible cold, or you're just sneezing and coughing and you don't feel good, so you're not getting up and you're not exercising, you're not doing your normal routine, that can wreak havoc on your pelvic floor as well. If you have a BMI greater than 25, so if you are heavier, it has more content. Your abdominal wall is heavier. Everything is heavier and pushing down on the pelvic floor more. If you've had a trauma to your pelvic area, fall, broken your hip, some people break their pubic symphysis, which is right in the front, right where the bones connect in the front of your pelvis. If you've broken that, that's also a pretty good area that you may have some pelvic floor problems, or you've had a long history of back pain. So that takes one of the three out. So you got the abs, the pelvic floor, the back. And so if you've had a long history of back pain, your back is probably given not as much as it should be in this symbiotic motion. I just wanted to get on here and share a little bit with you. So pelvic floor, a little more in depth. Any kind of questions or anything like that, I'm always happy to answer. Leave a comment or anything like that, and let me know what else you would like to hear.